A pandemic is a global disease outbreak. An influenza pandemic occurs when a new influenza virus emerges for which people have little or no immunity and for which there is no vaccine.
It is difficult to predict when the next influenza pandemic will occur, or how severe it will be. The disease spreads easily from person to person, causes serious illness, and can sweep across the country and around the world in a very short time.
An especially severe influenza pandemic could lead to high levels of illness, death, social disruption, and even economic loss. Everyday life could be disrupted because so many people in so many places would become seriously ill at the same time.
The impact could range from school and business closings to the interruption of basic services such as public transportation and food delivery. During an influenza pandemic, a substantial percentage of the world's population would require some form of medical care. Healthcare facilities could become overwhelmed, creating a shortage of hospital staff, beds, ventilators, and other supplies. Surge capacity at non-traditional sites, such as schools, might need to be created to cope with this demand. The need for vaccines during this time is likely to outstrip supply, and even the supply of antiviral drugs is likely to be inadequate early in a pandemic.
Difficult decisions will need to be made regarding who gets antiviral drugs and vaccines. Decisions even you may have to make. You may be the very difference your community needs. The influenza virus occurs throughout the world.
Influenza A infects both humans and animals. Humans, however, are the only known reservoir of influenza types B and C. Influenza is primarily transmitted from person to person via large, virus-laden droplets that are generated when infected persons cough or sneeze. These large droplets can then settle on the mucosal surfaces of the upper respiratory tracts of susceptible persons who are near, meaning within 3 feet of, the infected person. Transmission may also occur through direct or indirect contact with respiratory secretions, such as touching contaminated surfaces, then touching your eyes, nose, or mouth.
2 types of influenza vaccines are currently available in the United States.
In 1940, trivalent inactivated influenza vaccine, or TIV, was developed. Then, in 2003, the United States approved the live attenuated influenza vaccine, or LAIV.
To be most effective, annual influenza vaccination activities should be held by December, just prior to the onset of flu season. Persons 6 months of age and older with chronic illness should receive vaccinations annually.
These include pulmonary illness, such as emphysema, chronic bronchitis, or asthma; cardiovascular illness, such as congestive heart failure; metabolic diseases, including diabetes; renal dysfunction; immunosuppression, including HIV infection; cognitive dysfunction; spinal cord injury; seizure disorder, or any neuromuscular disorder. Furthermore, vaccinations are also recommended for all people who have frequent contact with at-risk patients, like family and healthcare providers; students; people traveling outside the U.S., and providers of essential community services, such as firemen and police. As always, please contact your doctor to determine what is right for you.
Influenza A viruses are constantly changing, and other strains might adapt over time to infect and spread among humans. It is likely that some genetic parts of current human influenza A viruses originally came from birds. The risk from avian influenza is generally low to most people because the viruses do not usually infect humans.
However, H5N1, more commonly known as bird flu, is one of the few avian influenza viruses to have crossed the species barrier to infect humans, and it is the most deadly of those that have crossed the barrier. Health professionals are concerned that the continued spread of a highly pathogenic bird flu virus across Eastern Asia and other countries represents a significant threat to human health. Since 2003, a growing number of human bird flu cases have been reported in Europe, Africa, and Asia.
More than half of those infected with bird flu have died. Bird flu has raised concerns about a potential human pandemic because
it has been especially virulent. It is